Hi everyone, welcome to quiz 3 of top 200 drugs. This week's quiz is on CNS drugs. The first drug name is donepezil or brand name Aricept. It is acetylcholinease inhibitor used in treating Alzheimer's dementia. So acetylcholinease is an enzyme that breaks down acetylcholines in our brain, which is a really important neurotransmitter that affects our brain and many parts of our body. So by blocking this enzyme acetylcholinease, we increase the amount of acetylcholine that is in our brain because it is thought to be that lower amount of acetylcholine in the brain is the cause of Alzheimer's disease. So this is one of the first line agent that is used for Alzheimer's. The second drug, mirtazapine or Remeron brand name, it is alpha 2 antagonist, mainly working in our brain. Can be used for major depressive disorder, but more like as an adjunct therapy or like a second line, not really as a first line. We're going to talk about the first line therapy, SSRI, or selective serotonin reuptake inhibitor later. So the major side effects from mirtazapine are weight gain and drowsiness. So kind of using those side effects, utilizing them, we can use mirtazapine for patients who have anxiety and sleep disorder. So drowsiness can cause patients to sleep better and kind of calm down, and also can be used for patients without appetite to give them more appetite because of its side effects of weight gain and craving for food. Buspirone or brand name Buspar is anti-anxiety agents used for treating generalized anxiety disorder. Has a little bit lesser sedation sedative effect than benzodiazepine. So remember we learned clonazepam and diazepam, which are benzodiazepines, in week one. Has also has less potential for abuse than benzodiazepine, so it can be used instead of the benzos for patients who have potential for abuse, kind of as used as an add-on therapy for depression as well. Bupropion or brand name Wellbutrin. Just notice the drug we just talked about, buspirone and bupropion, have very similar names. So make sure that you know the difference between buspirone and bupropion. So bupropion is dopamine norepinephrine reuptake inhibitor used for depression, smoking cessation, and seasonal affective disorder. Especially for smoking cessation, it actually has different brand name, Zyban. You don't have to know that for this quiz, but know that they manufacture different brand name for the purpose of smoking cessation. There are many different strengths and different types of formulations available. So you'll learn that later in class. Levetiracetam or brand name Keppra is anticonvulsant agent, basically used for seizure disorder. It is used mainly as an adjunct therapy with other first line agents for treatment of seizure. Aripiprazole or brand name Abilify is an atypical antipsychotic. There are many indications for this drug, but schizophrenia is a major one, bipolar disorder. It can also be used as an adjunct therapy for major depressive disorder. So remember learning Seroquel or quetiapine in week one. So that's when I kind of talk about the difference between atypical and typical antipsychotic. The atypical is a second generation antipsychotic that has lesser side effects that are typical or first generation antipsychotics have. So remember, every piprazole is one of them, very similar to Seroquel or quetiapine. Risperidone or Risperdal is another atypical antipsychotic that can be used for bipolar mania, bipolar maintenance. It's not here, but also used for schizophrenia. So Risperdal is one of the really first line agent that is very prevalently used in hospital or any type of settings. Butalbital, acetaminophen, caffeine. It's a combination drug uh, of barbiturates with the brand name Fioricet. It is used for tension or muscle contraction headache. So butalbital, which is a major component of this drug, its class is barbiturates, which is CNS depressant that are effective as anxiolytics, hypnotics, or anticonvulsants. Has some weak analgesic effects. Um, this is a case we use this for this drug in this case. One thing you need to really know is Fioricet, which is acetaminophen, um, is non-controlled substance, whereas there's another combination very similar, butalbital, aspirin instead of acetaminophen and caffeine. That brand name is Firinal, which actually is controlled substance in C3 class. Both Firinal and Fioricet with codeine are scheduled drugs in C3 class. Because butalbital has potential for abuse, it is really not recommended to be used for a long period of time. It's more for short-term use, and it really is not really preferred as a choice of pain management anymore. All right, lorazepam, its brand name is Ativan, another benzodiazepine. So you kind of see the pattern: lorazepam, clonazepam, diazepam. So you can see these are benzodiazepines used for anxiety disorder, insomnia, and seizures. Dextroamphetamine and amphetamine combo drug. The brand name is Adderall. It is a CNS stimulant used for treating attention deficit hyperactivity disorder. So it is a combination of drug that has 75% of dextroamphetamine and 25% amphetamine. So it is one of the first line agent treating ADHD. Lisdexamfetamine or Vyvanse brand name. It is another CNS stimulant very similar to Adderall. Actually, it is a prodrug of dextroamphetamine, which is a part of Adderall. What that means is when you take it by mouth, it is metabolized into the active drug, which is dextroamphetamine. So also used for ADHD. It also another indication that it has something that Adderall doesn't have is for treating binge eating disorder. Methylphenidate or brand name Ritalin comes in both long-acting one, Ritalin LA, or it also comes in immediate release one. So used for attention deficit hyperactivity disorder, ADHD again, and also has indication for narcolepsy, which Adderall also has. So Ritalin and Adderall are the two first-line agents for treating ADHD. Works very similarly to Adderall, but works sooner and reaches peak more quickly than Adderall does. Propofol or brand name Diprivan is anesthetic agent that is used for general anesthesia and sedation, mainly used in hospital in ICU settings before going to surgery or patients who are in a lot of pain. Zolpidem or brand name Ambien is hypnotics, so it is actually classified as non-benzodiazepine hypnotic used for insomnia. It is not supposed to be used for chronic use. It is more for short-term use. It used its own Beers list which means that it is not supposed to be used for patients, elderly patients over the age of 65. Buprenorphine, naloxone, or brand name Suboxone, it is the combination of buprenorphine, which is opioid partial agonist, so exerting its analgesic, so pain relief effect, combined with naloxone, which is opioid antagonist. So basically, it's gonna bind to the receptor of opiate receptor and displace opioids. So kind of like counteracting opioids. So this combo drug is used for opioid dependence because when it's taken by mouth, sublingually, usually it comes in sublingual tablets or film. So when it's used properly, naloxone doesn't really act. So buprenorphine will have analgesic effect. However, when it's dissolved in water and injected, which most patients who are abusing these opioids drugs do, then now naloxone will have an effect that are antagonizing buprenorphine, so which will cause all the withdrawal symptoms because now you're not getting that opioids. So also buprenorphine has ceiling effect, which helps that it's not going to cause overdose by taking more than how much you're supposed to take. So this is major drug that we use for patients who are opioid dependent when we're weaning them off of the drug abuse. Citalopram, or brand name Celexa, is selective serotonin reuptake inhibitor, or more commonly known as SSRIs. This is a major drug that we use for depression. So Celexa is one of the most commonly used SSRI because of its cheap costs, available in generic and everything. So we use Celexa or citalopram quite often. Fluoxetine or Prozac is another SSRI that we use very often. It has indication for depression, obsessive compulsive disorder, OCD, or bulimia nervosa. So fluoxetine is very long-acting SSRI, also very activating, which means that it'll keep you awake. So this is a one that you have to take in the morning. Otherwise, it can keep the patients up really late at night. Venlafaxine, or brand name Effexor, is a serotonin norepinephrine reuptake inhibitor, working both on serotonin and norepinephrine, whereas fluoxetine and citalopram were just a serotonin reuptake inhibitor. It is working very similar to SSRIs when it's at lower dose, but when dose gets higher, it works on both serotonin and norepinephrine. So we need to be careful using this at higher dose. It is used for depression and generalized anxiety disorder. Duloxetine, or brand name Cymbalta, is another serotonin norepinephrine reuptake inhibitor, or SNRI, very similar to venlafaxine, but duloxetine is used more for diabetic neuropathy or fibromyalgia, that for its effects in relieving neuropathic pain or nerve pain. Sumatriptan, or brand name Imitrex, is one of the drugs that are known as triptans that are used for acute pain relief of migraine headaches. So it is classified as serotonin 1B, 1D receptor agonist, but more commonly known as triptans as an acute rescue medication for patients with migraines. So we're going to learn more drugs in this class later on. So that's all I have for today. If you have any question, feel free to email me at any time or stop by my office. Make sure that you guys know the drugs that are in similar class and also be able to differentiate drugs that are having similar names. All right. Bye.